Welcome to the Asking Clinical Questions page of Research Engineer. This page is focused on helping you ask valid clinical questions using the PICO mnemonic. Well-built clinical questions are structured in two different ways: background questions and foreground questions. Background questions are asked to obtain pertinent knowledge about a given disease state, diagnostic test, or treatment regimen. These questions are focused more towards learning general information rather than evidence of some sort of causal effect. Background questions have two components: a question root and a verb, and then a disease state, diagnostic test, treatment, or medicine. Foreground questions are asked to obtain clinical evidence to inform upon decisions made in the current patient environment. This question has a singular focus on precise and accurate clinical data that will have an impact directly on patient care. Foreground questions follow the PICO mnemonic using these components. The P stands for patient, population, or problem. The I stands for intervention, exposure, test, or agent. The C stands for the comparator group or the comparison, intervention, or control group. And O stands for the outcome that is clinically relevant in the given situation. Now that we know how to structure a clinical research question, we have to look for where research questions may spring up in our clinical practice. Most publications show that research questions are naturally yielded from the clinical findings from patient examinations and tests, the diagnosis of a patient's clinical issues, the etiology and risk of disease states that are diagnosed, applying and interpreting diagnostic tests, being able to understand the progression and prognosis associated with a disease state, choosing the best treatment methodology for your patients, preventing disease by identifying risk factors and doing preemptive screening, providing patients with relevant information regarding their clinical issues that they can understand, and continuing to learn and grow as a clinician by applying the newest, most evidence-based, appropriate tests and interventions at your disposal. Click on the Acquiring Clinical Evidence button to continue.